hate to be the one to break it to you, but sex education of the past failed us. Because birds and bees, they don't fuck. Welcome to Birds and Bees Don't Fuck, a podcast where we learn exactly how bad our formative sex education, or lack thereof, really was. I'm your host, Ariel Zadok. I'm a producer, intimacy coordinator, and sex educator. My guest today is a pelvic floor physical therapist and owner of the Pelvic Model in Pasadena, California. Welcome to the show, Dr. Rachel Daof. Yay!
Thank you. Glad to be here.
I'm so happy to have you.
Yeah.
I
I'm
met
glad.
you in a really interesting way because I was coming into your space to do a test for lioness. So I was coming in to kind of have your services / not, because it wasn't necessarily for that, but it was the first time that I was in a specifically pelvic floor physical therapy space.
Cool. Well, yeah, that's pretty awesome. And I'm glad we had that. So Lioness came to the clinic so that we can test out their vibrator that also has biofeedback. So glad to have people willing to donate their bodies to science.
Yeah.
Yeah.
It's the first time I've donated my body to science, and I'm glad that it has to do with pleasure and orgasms.
Yeah. Yeah.
It is really cool, though. So I think a lot of people probably have no idea what a pelvic floor physical therapist is. I know that I wasn't really introduced to it until I started studying sexuality, and I was like, oh, wow, there's a specialty in this area. So tell me a little bit about what that even is.
Yeah, I feel like in the world, we're kind of like unicorns, where sometimes it's really hard to find a pelvic floor physical therapist. But I feel like the industry is like now on the upswing. A lot of people are hearing about it. But pelvic floor physical therapy, to put it like the easiest way to say it, is that we help people pee, poo, and have sex, pleasurable sex too. So yeah, that's like the easiest way to put it.
I love that. We help people pee, poo, and have sex. All of your basic needs.
Oh yeah. Yeah, the very foundation of our being.
It's literally the foundation of our being because it is that girdle down there. And it's so interesting because I think so many people hear of Kegels and everyone's like, yeah, just do your Kegel exercises. But there's such a common misunderstanding that you can't just do Kegels and that solves things. And for some people, that actually makes things a lot worse. So there's so much like undoing that we have to do in this area.
Yeah, definitely. And I'm so glad that you say that too, mainly because it's like if you're already coming in, let's say you're coming in for painful intercourse and you have a vagina and your muscles are already really tight, like doing Kegels is not going to make it better. It's going to make everything, the muscles are more tight and then more painful sex. So, yeah.
Yeah, it's like when people work out really hard. I mean, we talk about this in yoga, and so it's like if you have somebody that's working out really hard and they're lifting a lot and they're using their muscles all the time and all their muscles are really tight, their inclination is going to be to go into a vinyasa class, which is going to be that fast and lots of different poses, and it's going to be strong poses and all of that, and it's going to be that high energy. But what they actually need is a yin practice, which is lots of slowing down, lots of long holds, and it's like the complete opposite of what they do. And it is really, I mean, it's all muscular, right? So it is
Oh,
something that's really similar.
yeah, I love that you said that too, because we have a lot of men that do come into the clinic as well. So that's another theory, or another thing that a lot of people don't know, that it is for all genders, and a lot of men do come because they lift a lot of weight and they never take the time to stretch, so they get that like perennial like zinging or
Mm.
tip penis pain. So, and yeah, and we do recommend yin yoga for that.
Yeah. And it's like, that's the thing too. I think that God damn, we gender everything so much, and so many people are missing out on healthcare and pleasure and all of these things. And everyone has a pelvic floor. This is
Yeah.
not just for people who have vulvas and vaginas. It is every single person. Otherwise, your insides would collapse.
Yeah. I have a friend, a pelvic physical therapy friend, who said it like, we don't say. She says if you have a butthole, like you have a pelvic floor, because
Yeah.
like because
Otherwise, everything's spilling out everywhere.
yeah.
Oh man. So I know that your practice is in Pasadena, but where did you grow up?
I grew up in Palmdale,
Oh, you
California.
did? Okay, so pretty close.
Yeah, I grew up just in the desert right here.
Yeah. And that's a pretty small town in terms of how many people would be in your school, right? Or is it bigger?
I
Because
think
it is
it's
in the middle of nowhere, so it's everybody.
I feel like it's very vast and wide, so there are a lot of people there. It is small though compared to like Los Angeles City.
Oh,
Yeah.
yeah. Well, I mean, I think everything is.
Yeah.
But it is pretty close. Yeah. What do you remember, if anything, from your sex education in Palmdale?
I was thinking about that. I and honestly not much. I remember I had it in 6th grade. And my teacher was really uncomfortable.
Yeah.
That's like the one thing, is like she just did not want to do it, and that's what how she like prefaced the whole
Oh,
thing.
no.
She was like, just so you know, I don't want to do this, but I have to.
Cool. Cool, cool, cool. We're starting at a great place.
Yeah, yeah. And then like after that, I remember switching to the other side of town. And they had their sex ed at a different grade. And I I was trying to remember what I remembered for sex ed, and this is also what I remember. It's like they had it in a different grade. So I missed out on some sex ed that they learned, and part of it was like how to put a tampon in.
Oh,
And I was like,
wow.
oh man, like I'm supposed to go to Hurricane Harbor, which is like a water park place. And I was like, I don't know how to put a tampon in. I missed the
Oh, no.
lecture.
God, that
Yeah.
that was so much pressure as a kid because really, like I don't remember too much, but I do remember my mom being like, "You're too young. Like you're not using this just yet."
Yeah.
But there
Yeah.
is nothing. I actually saw something. Planned Parenthood had posted something today. It's funny that you're bringing this up of how to put in a tampon. Like how it showed it was a an animation of somebody putting in a tampon, how the string hangs out, and then pulling out the tampon and putting it in the box or whatever. And it's such a valid point that we're just like expected to know how to put this wad of cotton up your
Yeah.
vagina as
Yeah.
a smaller child and the pressure of going to a water park as a
Yeah.
young girl having your period. Ah!
Yeah.
Oh my gosh. So
Uh,
do you remember like did you just have to ask your friends? Was your parent guardian open to talking to you about that kind of stuff?
yeah. So I grew up in a Filipino household. My mom, she's very laughy, jokey, but in her own way, she didn't answer.
Yeah.
She didn't answer the question. I had an aunt who lived across the street. She's a nurse, so she was just like, go across the street and ask your aunt.
Yeah.
But I ended up having one of my friends show me and tell me. But yeah,
Yeah.
that's the story.
I mean, that is where we get our education when we're young. It's like, what do you know? What do you know? What do you know? What do you know? And half of it is just rumors.
Yeah, yeah, exactly.
Oh, so okay, so you didn't learn about the tampons. Is there anything that that sticks out to you? I mean, it's so hard for us to remember these things. It's such an interesting thing that I'm asking people questions that I can't even remember myself.
No, no, no. It is hard to remember. The other thing that I did remember is the box of questions.
Oh, like the anonymous questions box?
Yeah, yeah. I forgot what's in there, but I remember that ooh, go ask the box kind of thing.
Yeah, ask the magical box, which is,
Yeah.
ask the magical box what it wants, to be fair.
And then my teacher didn't even want to answer the questions.
No. So you had all the questions in a box and she was like, "I'm uncomfortable. I don't want to do this."
She would just like go through it as like fast as she could. That's honestly the biggest thing that I would remember about sex ed.
Yeah,
Yeah.
the avoidance of sex
Yeah.
ed. Oh
It
my
was like weird
gosh.
for everyone. So
What subject did this teacher normally teach?
So in my sixth grade, it was still elementary school where
Mm,
you don't go from like science to like math.
okay.
We taught everything. Yeah,
Was it a man or a woman?
it was women.
Okay. Yeah.
Yeah.
Oh, they were all so uncomfortable. I mean, still people are, and I mean, that's the thing with sex. Like people, it doesn't
Mhm.
matter what the situation is, people are still so uncomfortable talking about something that we all experience. It's all just body stuff. Like we can talk about our nose, we should be able to talk about our butthole or a penis or
Definitely,
whatever. I mean,
definitely.
especially for you and what you do, that must be a very big challenge.
Yeah, definitely. We see it all the time. Like, the pelvis is still a very taboo thing, and people don't know what their vagina or their vulva looks like prior to going to like a professional. So, if it's like more red or irritated, they have nothing to compare it to because they weren't taught to look at it.
Mhm.
So that's like a big thing that we find as well. Yeah.
Yeah, you got to know that baseline.
Yeah.
It's
Yeah.
so important. Also, I mean, aren't you curious? Don't you
Yeah.
want to know?
I
I mean,
suppose.
for the most part, I think people are afraid of it, right? Like
Mhm.
there is, especially with vulvas, there's so much negative messaging that we receive, especially as young girls. We get like wizard sleeves and beef curtains and roast beef and
Yeah.
like all of these derogatory things about vulvas that look perfectly normal and natural. And we
Mhm.
also don't get to see what other people's vulvas look like. I was a camp counselor and I had really little ones, but I remember in the grade not grade 5, god, that would be old. The 5-year olds, the little boys like 3, 4, 5, they were like all in a bunk together, 4 and 5-year olds. And boy, getting those little boys changed for swim was such a thing because all they wanted to do was run around naked and look at each other's penises and look at their own penises and like, do silly things. And we'd be like, you have to go to swim or like you have to eat lunch. Like you got to put your pants on so we can go get lunch. But that's not an experience that girls have because obviously our anatomy is a little bit more hidden, but because of all of the messaging that we get.
Hmm. Yeah, yeah. And it's funny that you say that too. This is off of like a different topic. It brings me to wonder like why we really separate male and females with sex ed, because like I was talking to some of my girlfriends the other day. I was like, I really don't know what they were taught. Like
Mhm.
what were they saying to these boys? Like I don't know. Yeah.
Yeah, it's so valid. And that is something that comes up with pretty much every single one of my guests is like, yep, they separated the boys and the girls, and we learned this, and I don't know what they learned. And girls get like there was one of my guests, I think they both got care packages. I don't remember now. But I know the girls definitely got care packages with tampons in it, but like we don't remember what the boys got. And it's like, well, what did you get in yours? You're pretty
Yeah.
young, so I don't think that you got care packages. I will say in purity culture, the messaging was definitely different. I spoke to one of my guests that it was I think it was Tara Ace that had this story. And they were saying that the girls were like, your virginity is everything and you're going to be ruined and like your life is over and blah, blah, blah. And for the boys, it was like, well, listen, don't have sex, but if you do, just like don't tell your wife because it might make it weird.
That's
I
wild. That's
know.
most wild one. That's crazy.
Yeah, that one's a really good episode. I think that might air like either right before or right after yours, but it's stories like that and like you're right, we have no access to that. We don't know what they're learning and they're definitely not learning about how our bodies work.
Oh, yeah, that's crazy. And it's like I remember a while ago I was looking at the stats of like how many states even have sex ed,
Oh,
and
yeah.
even yeah, and like even lower amounts of states are like required it to be medically accurate, which is crazy.
Mhm.
So that's why you
Yeah.
get like these weird situations.
It's in like I think it's in the teens of in
Mhm.
term I think it's something like 15 or 17. I think only I I might be so vastly misquoting this because I haven't looked up these stats in a really long time and I need to, but I think it's something like 32 states require sex ed and only
Mhm.
like 15 or 17 require it to be accurate or something. Like it's something that's
Yeah.
shocking.
Yeah, it's something that's like it's like not okay. What
Yeah.
like what the
Yeah,
stat is.
because so much of it is like abstinence based too. And instead of focusing on harm reduction, it's all abstinence. And I mean, studies have shown over and over and over again that accurate and good thorough sex education leads to less pregnancies, less STIs, less domestic violence, less, spousal abuse or domestic abuse of all sorts, not just violence, but abuse.
Mhm.
It's like, what are we doing? You're so
Yeah.
afraid, like you are making people get pregnant, like you are causing people to have to run and get abortions and things like that because you're not properly educating them.
Mhm. Yeah. Yeah, that's true. And I don't know. I'm just like hoping someday like we'll be able to figure something out because like those stories is just that's wild.
It
The like
ain't
the
working. It
that's
ain't
not
working.
work. Like we need to turn it around.
Yeah, yeah, exactly. And so for you, this is a very specialized area for you to get into. And when did you even become aware that, well, actually, let's go real far back. When did you even become aware that a pelvic floor existed?
Honestly, that's crazy too because I didn't know we had like I didn't hear the words pelvic floor until I was in physical therapy school.
Wow.
And they didn't the first time I heard it, it wasn't pelvic. I heard someone say women's health. Like they wanted to go into women's health.
Oh,
And
yeah.
that's like in physical therapy school too. And then so I just kept asking about it. And one of my teachers specialized in pelvic health. And I was very like tuned in to everything that she said. And she was my anatomy teacher in the cadaver. So she would like show things around the pelvis on the cadaver, which was pretty cool.
Wow.
I was
Oh,
like, this
man. And
yeah.
for people that don't know what a cadaver is, can you explain that?
Yeah. So, speaking of donating your body to science,
Good segue.
so they take bodies that are donated to science, and then they those are the bodies that you use to dissect. So it's just a fresh body that I guess am I saying this right? I'm like
Yeah.
talking in circles. Yeah, it's like a body that you
Yeah.
dissect. Something that you would have like in high school. I think they use frogs a lot in
Yeah.
high school. In a lot of medical programs and physical therapy programs, they'll use a human. Yeah,
Yeah. Yeah. Which
yeah.
is, that it sounds really probably gross and barbaric, but it's also really important because we do need to understand how the body works and how things are actually connected. I mean, you can only see so much on an MRI.
Oh yeah, that's totally true too. After my experience with the cadavers, I immediately made myself a donor for organs and anything because it's just so valuable how much you learn
Yeah.
over the cadaver. Yeah.
Yeah, it's so true. I'm a donor as well because it's just like, I mean, what do I don't need it afterwards. Like I'm dead. What do I care? I
Yeah.
mean, that goes into like different realms of like belief systems and everything. And I grew up in a Jewish household, so like that's probably not a thing for Jews, but I'm like, I am not, so I don't care. And I would rather give my body to science than
Yeah,
religion.
definitely.
So, okay, so you're all up in that cadaver. That must have been fascinating.
Mhm. Yeah, it's pretty cool. It is pretty cool because then you could see how much, like how the organs really fit into such a tiny itty bitty space. I was thinking I should go back and apply to be like one of those teacher's aides so I could just see it again and teach it.
Yeah.
So that's really cool just to see everything in such a little space and the organs, how they go into like the orifices for like peeing and pooping and sex and everything. That's pretty cool. And having that specialist teach it too is it just gives it another layer of like wow, like somebody who's passionate about her job and is teaching you in like such like, it's a crazy setting. So like
Yeah.
awesome. And so so yeah, that's what her she's thank you, Dr. Heather Akley. Like, you changed my career path. Yeah.
Yeah. Wow. So you originally went to school just to do like regular physical therapy. Did you, and then you were like, oh my God, I must do this.
Oh yeah, it's so much cooler. I feel like I feel like it's more interesting. And beyond like the interest level, I feel like we people need pelvic floor physical therapists. There's so few of us,
Oh,
and
yeah.
we need more. And it's good to have people working in the realm to help others. Yeah.
Yeah. And so it raises a good point because there are so few pelvic floor physical therapists. And then it's really also important to recognize that even within that practice, just because you're working on a pelvic floor doesn't mean that you're sex positive. It doesn't mean that you're an ally. It doesn't mean that you are a safe person, which is really scary because there are so few of you and there are so many people that really truly need this. And then to be working with a doctor that maybe isn't sex positive or is like, super religious and,
Mhm.
that's challenging. So like, if you're interested, come and be a pelvic floor therapist.
Yeah, and I always say, like, man, we truly need more, to your point, because if you don't jive with one and there's only three in the area, like,
Yeah.
it could be really scary to put your hands or put your body in somebody else's hands, and there's like you only have three options. Like, yeah. So
Yeah.
yeah.
And I think just generally, there is, when it comes to doctors and therapists of any type, regardless of what the practice is, I think people really just see like person of authority. They have to know everything. They have to be the right one, especially when it comes to therapy. If it took you so long to actually pick up the phone or log online or whatever and get to a therapist and they're not the right fit, people assume that like every therapist is the same and absolutely not. That's absolutely not the case. So it is dating and dating sucks, but like you got to do it.
Yeah, you do. And I truly recommend like it's kind of like finding your psychologist. You have to
Mhm.
like it takes a while for some people, and unfortunately it takes a while, but like yeah, you got to do it. You got to find which one meshes with you. I'm sure not everybody meshes with me. And I truly don't take it personally. It's just you need to find somebody that's really going to help like make you better. That's what you're there for.
Yeah. Yeah, and this is more of mental health when it comes to therapy, but I'm sure it's the same with physical health as well, is that you can have a doctor in front of you or a practitioner in front of you who is so super qualified, they're amazing, they've got all the studies, they've got all the things, but if you don't jive with them, they're not
Yeah.
going to be able to help you. So the person sometimes that has maybe less stuff on their wall or different, not necessarily with physical. I mean that you need all the things for sure, and it depends on the type of therapy. If it's an intensive therapy, like you do need certain things, but it's so much more important to find the right relationship in terms of the interpersonal relationship between the two human beings than it is to find the person that has like this and they've been in this hospital and they've been in this place because
Yeah.
that doesn't mean that they're actually going to be able to help you. And again, I recognize with physical modalities, it's a little bit different than mental health. And you
Mhm.
do, there's a lot of caveats in that phrase, but it is really, really important. But I'm very
No,
happy that I know you and I can refer people to you.
and I'm glad I know you too. And yeah, I feel like soft skills are truly underrated
Oh my
in the med.
God.
Yeah, it's truly underrated. And I feel like just having that comfort with your, especially pelvic professional or even OB-GYN or urologist, like you have to be able to tell them that your genitalia hurts. And if
Yeah,
you're not,
and why it hurts, right? Like you have to be able to talk about your experiences. Like, oh yeah, I was having sex the other day and like the toy or the penis hit me there and that was a new feeling and I'm scared now or
yeah,
like whatever it is.
yeah, exactly. Or like how it happened. Like if you're to if this is why like the whole taboo thing I think needs to like simmer down on the pelvis,
Mm.
because like if you're too scared to tell your doctor that you're doing like some anal play with a vibrator and it hit something wrong and now your pelvic floor is like in a spasm, like you have to be able to tell that story some way or another. And if you can't, then it's a problem. It's like we're
Yeah.
not here to judge you. And it's like that's what happened. Thank you for telling me the story. Now it gives me a clearer picture. But yeah, that's just another rant on the the taboo pelvis.
Yeah, it's so valid though, because, and especially if the person who is coming in is a cis straight man, there's
Hmm.
so much shame involved in saying that, yeah, I like anal play. Meanwhile, the reality is that there is so much pleasure to be had with people who have penises because of where you can get to with the prostate and what, whatever. So it's, yeah, I mean, we need people like you to help us break down those taboos and normalize. Like we're recording now in anal August, even though this won't air until I think September. But it's just we need to start breaking down those barriers because pleasure is pleasure and there are infinite ways to experience that, but you're
Yeah.
not going to get there unless we can like talk about those things. And if you get hurt, that's totally normal. Like normalize getting hurt.
Yeah.
That sounds
Yeah.
weird.
Yeah. Yeah, I know. Like I always say, like sex shouldn't hurt unless you want it to. So
Yeah, yeah. It's so true. That's 100% true. And it's such a valid point too, because I think a lot of people with vulvas, sex is painful, like for so many people for so many reasons, and a lot of it does have to do with the body not being prepared for penetration and for
mm-hmm.
whatever you're going to be doing in the bedroom. So much of it has to do with that you're not properly turned on and your body's just not ready to receive, and so it's tight and shutting things out. But that leads so many people with vulvas to feel like they're broken.
Yeah, and that just makes me so sad. It's like
Mm-hmm.
not all about like penetration. It's
Yeah.
about like the whole like making it's not just about penetration. I'm just going to leave it at that. And
Yeah.
it just makes me so sad that so many women are coming into the clinic and then just figuring out where their clitoris is for the
Uh,
first time. It's
yeah.
like there's just so much missing, like as you were saying, like in the sexual education aspect of it. And we can really do so much better. It's like imagine the world where everybody knew where a clit was. So,
Yeah. Yeah.
yeah, yeah. So
And then
I think
even,
we
oh no, keep going.
go on, go on. I was done.
Okay. No, there's also even another layer to that because there's okay, so there's the whole thing of like nobody knows where the clit is, like it's right there, like pointing to it. But then there's another layer of understanding that not everyone can handle their clit being touched.
Oh yeah.
It's
Ooh,
so intense. So there's
yeah.
like it's like the pendulum goes from like nobody knows where it is and we're like blaming everyone, specifically men and people with penises for not knowing where the clitoris is. And then like the people, and I'll just speak in the binary right now. So like the guys that want to be like I'm woke, I know where the clit is, and they go right for it. I can't tell you how many dudes like right away, like I open my legs and all of a sudden like their tongue's on my clit. I'm like, get the fuck out of here. What are you doing? Like, first of all, no one's ready to receive that. Second of all, you don't know that I like that. Like, calm it down.
Mhm,
So there's like this super misconception because now there was like this obsession with like find the clit, find the clit, find the clit. This is the money shot. This is the spot.
mhm.
But the reality is it is such a sensitive area that it can be really like speaking of pain, like that can be
Oh yeah,
really
that
painful for people.
can be painful. Yeah. Yeah. And just because we're talking about sexual education, it got me to think about this. You probably heard of Oh My God, Yes, right?
Oh my God, yes. I mean,
In my chair.
and that's good branding. Solid
Yeah.
branding, y'all. That is why. Yeah. Oh my God, yes is fantastic. Please sponsor the podcast. No, they're fantastic because it Oh, you tell them about it.
Yeah, so oh my god, yes. I haven't opened the site in a couple years though, but the site shows you different ways you can pleasure a woman, and I think when I got it, it was all external, and now they have like an internal model.
Oh, they do.
They
I
do now.
haven't been on in a couple years either, and it was all external, but they use real people. They're not
Yeah,
cadavers, they're real people, but it's real people. That would be awkward. That would be a little bit more like, oh my God.
oh
Oh my God,
no.
no. Oh my God, what? No, so they don't use cadavers. They use real people, volunteers that are there to show you. But it's really interesting because I think this is really the first time that it's like it's not pornographic. It is educational, and it's like this is what I like, and they give you a close up of that person touching their own vulva to be like, this is what it is, and this is orbiting, or this is back and forth, and this is up and down, or this is pulsing or whatever. So that's great that they do internal now too. I got to check that out.
Now. Yeah. And then like I think when I was seeing it too, like if you use your iPad or your mouse, you can like
Yeah.
copy the motions. Yeah.
Yeah.
Yeah. Cool site.
Truly, everyone who wants to pleasure a person with a vulva needs to sign up. They're not paying either one of us, but it's just
Yeah, no,
true. And it's
it
really
is.
affordable too. Like I think it was only like 50 or 75 or 100 or something like that. Like it's
Yeah.
very accessible. It's a one-time fee.
Yeah.
But to your point, the fact that you can play with it on an interactive, like in an interactive way, and you're getting that feedback,
Hmm.
it can be really scary for people who don't have, even for people, for anyone to play with another person's vulva. There is a lot of pressure, let's just be honest, because they're all so different and they are hard
Hmm.
to figure out, and there are so many factors at play outside of the physical touch and outside of touching the actual genitalia itself. But to be able to practice and get that feedback, even though it is, it's through an app, but it's still like, oh yeah, I know. We love animals here on the show. Usually, oh, what a sweetie. Yay.
There we go. He's
Usually
feeling
my
it.
cat Ruby comes on the show. She's actually snoozing right behind the computer. She's just been sleeping there the whole time, but she's generally very disruptive. So we're very pet friendly here.
Yeah, this guy's he's a barker.
He's so cute. So how long have you had your practice for?
So the practice has been alive since 2020. Yeah.
Oh,
Yeah.
wow. You
Yeah.
wait a
Yeah.
minute. Did you start this over the pandemic and then it
I
got
did.
hit?
I did.
No. A
I did.
physical practice starting in 2020. Tell me about that.
I mean, like, uh, for the sake of like physical therapy and stuff, when you're thinking about the pelvic floor. Okay, this is where it gets a little nerdy.
Yeah, let's get it. Let's nerd out.
So, so the pelvic floor is innervated partly by your autonomic nervous system.
Hmm.
And when you're thinking about the pandemic, everybody's autonomic nervous system was like fight and flight. Like everybody
Hmm.
is just like so up here. And how that translates is to a lot of like muscle guarding. And for people who are already experiencing pain, this is very subjective in what I experienced clinically. Like a lot of people had an uptick in pelvic pain. So
Hmm.
the pandemic in turn was a really good time to start
Yeah. Were
because
you
of
allowed to
that.
practice in person? Because it was medical. So,
Yeah, yeah.
oh, that's
It's a, yeah.
great.
It was an essential
Hmm.
business. Hmm. Yeah.
Yeah. Yeah. And we don't think about it much, but our pelvic floor is where we hold so much stress.
Oh yeah. So
And,
much tension.
and it's probably the most ignored muscular structure of our body.
Yeah. A lot of people don't know we have muscles there.
No, no. And even if you do, whether you're like consciously knowing that or not. I mean, when you hold your pee or you're holding your poop or anything like that, like that's you're using your pelvic floor, and you're using it in so many different ways also. But even if you do know it exists, you want to ignore it because it's part of like the taboo, like it all comes back to the taboo.
But it also can be like the most fun muscles.
Yeah.
So it's good to it's good to know.
Yeah,
Yeah.
absolutely.
Yeah.
How did you feel so when you were in school and you discovered the pelvic floor and all of that, how were you in your own sexual education journey, and was anything starting to come up for you as you were exploring this area of physical therapy?
So was there anything coming up for me? I feel like yeah, I give a lot of props to pelvic practitioners because when you're learning, most of us learn. Is this your kid?
This is, yeah. She's making herself comfortable on my lap, so I'm gonna adjust.
Yeah, but with pelvic practitioners, like I really truly give a lot of props to like this profession because we learn on each other. I
Yeah.
feel like the first time, so I'm very fortunate. I had, we call it a clinical rotation. So it's when you're still in school, but you practice physical therapy as like a professional, but you're just practicing under a licensed PT. So when I was fortunate enough to have a clinical rotation in a pelvic clinic. And the first time I did any sort of like internal was on my instructor.
Oh,
So,
wow, that is a
yeah.
lot of pressure. And when you say internal, can you explain to them what exactly that
Oh yeah,
means?
yeah, definitely. So internal is so okay. So in orthopedics, your everything is traditionally external, like your neck, your shoulders, your abs, your glutes. That's all what we consider like external. But internal treatment is when your practitioner will either go vaginally or rectally to access the pelvic floor muscles. So that's where we're like feeling how they feel, if they have increased tone or decreased tone. Tone meaning like, if you have like a really stiff neck, the tone of your muscles are pretty like tight and stiff. So that's what we're assessing for. How well they contract, relax, how endurance, etc. Yeah. So
Yeah.
internal is all vaginally or rectally. Yeah.
So that is, I think for most people, that's a lot to go into your instructor's body
Yeah.
in
Yeah.
that way, in it either rectally or vaginally. That I imagine probably. I mean, I don't want to speak for you. What was that like for you?
It was scary. It was really scary. You go in there my first week and we're like, okay, so this is the plan. We're going to shadow a bunch. And I was like, okay, cool. I can handle shadowing.
Yeah,
like,
that's cool. I could
like,
watch.
yeah, we can do that. And she was like, and then on Friday, this is what's going to happen. I'm going to teach it on you. And then so my instructor did internal assessment on me so I knew what it felt like. And then we switched turns and then I would do it on her. And I was like, oh shoot, Friday's coming. This is a little intimidating.
Yeah.
Yeah.
What
But
an
I
what an
feel like,
intimate experience to have with your
yeah.
teacher, because there are power dynamics with teachers, right? But this is the practice, and really you could have a celebrity coming in. You can have somebody coming into your office that is in a position of power, and what a great way to get over that real quick.
No, yeah. Yeah. I feel like one of my favorite patients when I was asking about, okay, so I usually go, urinary questions, bowel questions, and then I'm like, okay, so are you currently having sex? And just jump right into, not just jump right into, but then it starts getting very sexual. And he was like, oh, we're gonna be real friends. So we're gonna be friends. And I was like, yeah, we could just like rip that band-aid off.
Sir, my finger will be in your asshole. We are going to be friends.
Yeah.
Yeah. And it's so interesting because we separate sexuality so much from general health and just from our overall well-being, that it is a shock when when a healthcare practitioner of any sort asks you about your sex life and your sexuality and your
Yeah.
activities, and in your practice specifically, like, you got to know the goods. You have
Yeah,
it's
you
so
have
like,
to.
you have to know everything. But
Yeah.
it's so that's so scary for people.
It is scary for people, because you know when when we're typically talking about like sex, so like it's a sexual setting, not we weren't trained how to talk about these things
No.
to a professional or like in a medical setting, so it could be scary, and it's like very vulnerable,
Mm.
very vulnerable. And so like to anybody that's like telling me their story and saying it for the first time, it's like I really like thank them. Like that's hard to do in a lot. It's a lot for some people.
It is, and it's also, most people don't know how to talk about sex with their partners, let
Yeah,
alone a stranger, let alone a person of authority. So it's
yeah,
not just in this medical setting. Definitely, we're not used to that because, your regular physician generally isn't going to ask you about that stuff. Like, they might ask you if you have, a vulva because of pregnancy and things of that nature. But generally speaking, it, people are really reluctant to talk about sex. We're not trained how to talk about sex, whether that is thinking about it for ourselves and really diving deep into, what do I like, what do I not like, what are my boundaries. Most people don't even understand that they have boundaries or what a boundary is or how to communicate that or anything like that, even within themselves. And then you take it into the context of a partner. A lot of people don't know how to have those conversations. They might, like, minimally know how to have them, but then you put a stranger, and especially if you are working with a man or a person with a penis, and
uh-huh.
you are a woman, so that is another layer of, like, ugh.
Oh yeah, that's definitely another layer. I feel like the trend with that is I feel like the younger men in their 20s and 30s have an easier time of being like, okay, this is all my medical stuff. Like, please just help.
Yeah,
And those who are like older in like 50s or 60s, they like some of them are like they do it no problem. But I just noticed that there's like an age range where I'm like, okay, so I have to like be a little bit more this is what's going to happen before it happens kind of thing, and this
yeah.
is what we're going to do, and like 10 steps for like consent. Of course I'm doing that with everybody, but I just know that there's those people where you have to be like, this is for medical reasons, like, and this is why I have to do XYZ. Yeah.
Yeah. Which, to be fair, more doctors should be doing that anyway. I think the whole topic of consent in a medical setting is completely lacking. It's
Yeah.
completely lacking. I have never had a gynecologist ask me, is it okay if I put my hands on your breasts? Is it okay if I put my hands inside your vagina? Is it
Yeah.
okay if I touch your vulva or anything like that? They
Yeah.
might say, okay, I'm going to stick this inside. And by the way, that's the language they use. I'm going to stick this inside. And how, like, that's aggressive.
Yeah.
That's
Yeah.
really aggressive. Just
Really
to say, to
frustrating.
use the word stick or something like that, like,
Mhm.
that's a lot.
Yeah, it's a lot. There's like no prep, and like they're usually saying it like a millisecond before they actually go for
Mhm.
it. So it's
Yeah.
like there's no consent. And then I do think that with pelvic physical therapists, like truly, I feel like a lot of us are very well aware, and we're always looking at somebody's eyes, like, are they dissociating, do they
Mhm.
truly not, are they saying yes but they really mean no, like are they only saying yes because we're the professional and they have to
Yeah.
say yes, like you have to like really truly break down those layers and ask them like in so many different ways. It's kind of a skill of like how to ask and which words to use to make sure that they're okay, because well, like there a lot of people do come with trauma, and the
Mhm.
last thing you want to do is make them leave another medical practice and then they're crying because like they don't have answers and it hurt and they feel weird. That's not what we're trying to do. We're trying to truly help, and like being aware of like the like just like the body language and the layers of the dynamic here. It's like I know I'm like this, but I also know that like I am the professional and you're looking for me to guidance, and you truly don't have to say yes to everything that I'm asking you to do. I really want your true consent. So I know that that's very important in
Yeah.
our practice.
That's
Yeah.
breaking down the medical industrial complex.
Yeah.
Truly, that's a huge part of it. So thank you for doing that for sure. Not that I would doubt that with you, but like it's still, it's still worth saying thank you because it is a huge problem. And that is why there is so much mistrust and distrust in the medical
Mhm.
field. And especially
Mhm.
for people of color who were literally used as experiments for the vast majority of medical history. It's so important to be reading those signs and understanding the context of who a person is, and as much as you can read their intersectionality, what that is when they walk into the room. And so much of what you're talking about is emotional intelligence. And this is a lot of the training that we have to do as intimacy coordinators, sex educators, sex therapists, like pretty much if you're working in the sexuality field and you have gone through any sort of a credible program, you're going to be learning these things because it's
Mhm.
so important. So,
Yeah.
um, and sometimes you have to learn it on your own, but everything that you were talking about was emotional intelligence. And so I'm curious, within the physical therapy training, and this may just be more of like a pelvic training or maybe even your own training, was that
Mhm.
any part of your process in training outside of anything that you would have sought out on your own?
Honestly, I feel like I try. I don't know because now that I've done so much continuing education and
Yeah.
education, so now it's like hard to know which one came from like
Yeah.
university.
I definitely understand that.
It's like I don't know. I just know what I know. But
Yeah.
I do think that like in the physical therapy schooling, there's not as much as if you were to go to like pelvic continuing education courses. Like
Yeah.
I feel like with most pelvic continuing education courses, there's like a touch of like, but if like keep an eye out on this trauma related thing.
Mhm.
Um, I do think that a lot of the transgender courses do a great job, and it's like all the trauma awareness stuff
Yeah.
that you're going to get in trans courses could be applied in any setting. Like,
Mhm.
and I feel like they did such a good job to where you're asking like, do these lights bother you? like
Yeah.
it's very detailed. It's like, do you want this light on and this light off? Like, tell me. Like, do you like? I don't know. It just gets very detailed to the in depth and how to make a patient feel safe and actually working towards their goals versus like going a step back and you not realizing it. Yeah.
100%, because there's so much damage that can be done in that room. And when we're not trauma informed, and in any room, really, anytime you're working with anyone's mental health, which sexuality is intrinsically tied to mental health, all of it is, we have to be trauma informed. We have to. It's not even an option.
Yeah.
So, when you can come at something from that trauma informed space, regardless of who you're working with, you can handle it in a way that is going to be harm reduction focused versus getting your patient in and out. And that is something that generally the medical field is lacking. I mean, I have more training in sexuality as an educator than any medical doctor. I have more training in nutrition as a certified holistic health coach than any doctor. And these are things that it's like the Western model of medicine, they gotta get with it. They gotta get with it.
Yeah.
Like the general health, there's so much missing in that. And trauma informed training is missing. And sexuality and affirming care is missing unless you're seeking it out.
Oh, yeah. You definitely have to specifically go out of your way and find like a sex medicine doctor
Mm-hmm.
for like very specific details on not even it doesn't even need to be sex. It could just be like what's the entrance of the vagina, and like how does that play into like your pain with intercourse and your bladder discomfort. But
Mm-hmm.
like that's not, I might be misspeaking here, but I'm not sure if all gynecologists learn that, and like, and which courses are these people, are not these people, these, I love gynecologists. I
Yeah.
don't, yeah, but like
But they're not
what,
all built the same. They're not all
yeah,
great.
yeah, it's like you need to take certain courses and know where to go for these specific things. Um, and yeah, it's just, I just think it's really important for our population, because I know you work with like a very I don't want to say sensitive, but like we deal with a lot with sensitive topics, and just knowing how to navigate the world is very important.
Yeah. Yeah. It's so true. And it cannot be understated how important it
Mhm.
is to be trauma informed, to be knowledgeable on sexuality, on gender, on intersectionality, on emotional intelligence. These are things that, I mean, if all humans had this training, could you imagine if our sex
Yeah.
education programs included emotional intelligence, if it
Yeah.
included being trauma informed, as we grew up, age appropriate, of course, but like, how much better off would we all be in relationship if all of us were like just a little bit more trauma informed? And there's a
Yeah.
lot of like the whole TikTok thing, and like there is a whole conversation to be had around like self-diagnosis and TikTok diagnoses, and like that's too much. We can't go into that.
Mhm.
But if we were all just a little bit more trauma informed and a little bit more emotionally intelligent, I feel like we'd
Yeah.
be like so much better off as human beings.
Yeah, it would be so much better. Yeah. I was gonna say something, I lost it.
That's okay. What is this is normally I would be giving the comedians get a pop quiz, but my sexuality professionals do not, because that would be silly because you have so much information to share. What is one thing that you wish more people knew, or maybe like a sexy fun fact that you want to share? Just anything that you want to leave the people with.
Um, okay, so I was thinking about this. I can either, the two populations that I care dearly about are like men's sexual health and perimenopause. Um, this isn't necessarily a tip, but I feel like the world would do a, like we really need a place for women to go to learn about perimenopause
Mm-hmm.
and menopause. Just like sex ed is lacking, like there's no place where women like, or um, uterus owners to go uh, to learn about hormonal changes at the latter, like second stage of life. And that's I feel like there really needs to be work done about that. There's so much to know, and
Mm.
that's just one thing. And then the other thing that I was thinking is men can have pain with sex too.
Yeah.
You can have pain with sex too. It's not just a woman's problem. So if you're a man and your penis hurts after intercourse, and you're like, and it's not an STD or a UTI or something, it should keep your wheels turning to be like, oh, and what if it's like a musculoskeletal dysfunction? And I think a lot of men find pelvic PT through Google and Googling like my penis hurts, and then and not
Yeah.
even a urologist. So just know that that's a thing too, and there's help out there.
And
Yeah.
I love both of those things because they both deal with erasure. It's, like people who go through menopause, like once somebody goes through menopause, like, oh, you have no worth, you have no value, you're not sexy anymore, you can't make babies, blah, blah, blah. Like this like deep, disgusting history of erasure, which is like, actually, for a lot of people, sex gets way better and life gets way better. It's like a whole new delightful, exciting period of life that like, and yeah, I think the older people get, the sexier they are actually. And then, and even with men, people with penises and pain, I wouldn't say that that necessarily gets erased, but it gets ignored. It
Because
gets like, it's like they're not allowed to, it's just, it needs to be normalized. So I think those are two beautiful, brilliant things to raise. So thank you for that.
No, thank you.
Where can people find you?
So people can find me. So I'm the owner of the Pelvic Model in Pasadena, California. We also have Instagram at the Pelvic Model, TikTok, YouTube. We're working on beefing all of those up. So you'll get more content as it comes.
Yeah, TikTok is so hard. TikTok, they kick me off for everything. So I'm like figuring out how I can share. It doesn't matter what I'm doing. They're like, nope, can't
We
show
always,
this, mute this, blah, blah, blah. I'm like,
yeah,
oh God, you're just the worst. So
yeah.
I don't know. So I wish you the best of luck over there. It's
Thank you.
a, it's a maze. Thank you so much for coming on the show. This is such a fun conversation. There was so much to learn about what you do, and it's just incredible. So thank you so much.
No, thank you for having me. This is great.
Yeah. If you like this podcast, then please go ahead and like, subscribe, send this to a friend who may be curious about pelvic health and pelvic floor anatomy and cadavers. Leave a 5-star review. It really helps. This is a podcast in its infancy, so I can use all the help we can get so I can get more incredible guests like Rachel. And I think that's pretty. Oh, actually, this is going to be in September. So, the Distinguished Gentleman's Drive, which is a global fundraiser for men's mental health, suicide prevention, testicular, and prostate cancer research through Movember. We are doing the drive on Sunday, September 24th, worldwide. You can donate. You can sign up to drive wherever you are in the world. I'm the host of Los Angeles, and I'm also obviously raising money myself. So you can visit Babes in Classics, Babes IN Classics on Instagram. That's got all the Distinguished Gentleman's Drive stuff. But it's a great cause. It's all pre-1980s cars. People get dressed up all dapper and whatnot, and we drive around for a good cause. So I think that's all I gotta say. But thank you again. This was wonderful.
Thank you. Thank you. Love it.
Bye.